I hope you've enjoyed our meeting. 3 days of very intensive scientific work. We had a lot of researchers and we had a lot of scientists and physicians. Thank you again for attending this meeting and coming all the way along from your countries. And I would like to welcome the President of Ain Shams University, His Excellency the Ambassador of Nigeria, His Excellency the Minister of Higher Education. COLDA started last year, and we did not have as much attendance last year in Kenya as we're having this year. 2018, we had 175 registrations, and 2019, this version, we had 271. Attendees, we had 144 in 2018, and for our second year, we had 216. And the country representation in last year was 23 countries. This year, we had 35 country representations. But what about the scientific part, which is most important, because COLDA also would support research and would support scientific researchers and physicians. So not only we are supporting care for the patients and improving care and outcome, but also we want to improve the scientific outcome coming out from Africa. So the number of submitted abstracts last year were only 41, this year 128. Accepted abstracts, 32 last year, this year 113. Oral abstracts, 16 last year and 12 this year, so we need to increase the number of oral abstracts. However, we had 5 best posters that were presented today. The number of posters last year were 32, this year 101, while the numbers rejected last year were 9 and this year 15. So, I would like to thank for a lot Virology Education with all its team, Zara, Wilco, Ricky, and the rest of the team for the fantastic work they've done in organizing this meeting. Big round of applause. They had a very rough time. We had emails together all the time and people with delayed visas, and we had to solve problems, and it was day and night communications for the last few weeks to make this meeting happen at this level. And I hope that you're all enjoying it, and we are all eager to hear your feedback. And please send us an email and tell us how we can improve our next COLDA. That's probably going to be in a Francophone country, probably in Senegal in 2020. I would like to thank of course, the endorsers, starting with Ain Shams University, the Faculty of Medicine. We had huge support from the Ministry of Higher Education and Research, and among others who really supported us. I would like to thank FIND Diagnostics, the EASL, the European Study of Liver Disease, and all the civil society who contributed to this meeting and the success of this meeting. For the first time, we had a session that is dedicated to the civil society and NGOs, and this never happened in any scientific meeting before, and I think this is a big bonus for this meeting. And finally, I would like to thank Prime Tours, who've been really integral in organizing the accommodations, the travels, and also the audiovisuals for this conference. And a big round of applause for them because they've done a huge effort, really. One last thing, we would like to encourage you to go back to your countries now, and please relay your experience in this conference and try to stimulate your politicians and leaders to be committed to your programs to improve the liver health in Africa. And indeed, for next year, I would like you to start collecting your data, collating information as much as possible, and we are going to offer you eventually help in writing the abstracts and in improving the outcome of the publications. One last word to the Lancet Gastroenterology and Hepatology editor, Rob Briley, who really made it happen, and he made the trip to Egypt to give a lecture about how to publish in one of the most respected journals. So I would like to thank him very much, and he's hoping to be part of this meeting every year. Thank you again.
So I think you've seen from those figures how we've really grown since last year. I mean, it's been an amazing growth in a very short period. But there's always room for improvement. So the things that we need to look at, how can we expand? I think we're all very strong clinically. We've all shown that we've good experience in actually managing our patients. But we need to look beyond that. I think we need to look at research. And I think what's been shown from the abstracts, that we have a lot of data. We need to really just put this out. We need to put it together. And we need to use these type of meetings as a stepping stone to actually let the world know what we're actually doing and what we can achieve. So I think that's very important. I think I really encourage all of you to go back to your clinics to actually collect data, because data is knowledge. Without that, you can't actually change anything. You need to have that data to actually convince your departments of health, your finance ministers, that you need funding. You need to address the problem of viral hepatitis. But I think also importantly, we're going to look at actually expanding this also beyond viral hepatitis. We had excellent talks on non-alcoholic fatty liver disease, NASH, and I think we need to look at, also importantly, potentially looking at drug and toxin-induced injuries, which is probably often underestimated. Often that's put down to viral hepatitis. So we need to expand the areas in clinical liver disease that we're looking at. And then I think importantly, we heard that clinical trials are not done in Africa. And we all know we have centers that are quite capable of doing these trials. And particularly we're looking at cure for hepatitis B. Hepatitis B, Africa is the home of hepatitis B besides Asia. So we need to actually insist that we're part of these trials. But we also need to insist that we have adequate funding and infrastructures that are supported by a pharma that actually are doing these trials. So that's something that we need to be driving. And then in terms, I think we've seen that in order to combat viral hepatitis, this is really not just us. We need to involve our officials, our policymakers, and I think we need to make them part of this meeting. They need to be part of the team. So it's not us just complaining that they don't do this, they don't do that. They need to be part of us. When they're part of the team, we can actually make a difference. And then importantly, we saw that very good video of Lionel Messi, and I think we've all got people in our own countries, sportsmen, singers, and we need to actually involve them in actually identifying them as a promoter of viral hepatitis and how we can use them to get across the cause of viral hepatitis. Know your status, don't be stigmatized by it, and move forward. And then importantly, I think we've all made new friends, we've met old friends, and it's been a fantastic meeting, so thank you everyone.
Dr. John Ward, I would like to invite you just for a couple of minutes to give a few words, and thanks for you also for your support to the Egyptian program for many years.
It's been great. I've really been appreciative of being part of this. It's been a very energetic discussion for the last several days. We are brought together because of the concept and the opportunity for disease elimination of two major health threats in this continent, hepatitis B and hepatitis C. And to achieve as I mentioned, the ultimate goal of public health, which is health equity, that everybody benefits from a good health opportunity in a country, in a community. And I think we have seen how Egypt is really living up to that goal very ably in their hepatitis C elimination program. We talked and gave thoughtful discussion to the other aspects that need to come together for elimination: hepatitis B vaccination, particularly at birth, hepatitis B testing and linkage to care. And it's great to be coming together and share those opportunities and challenges. And that's what I'm trying to make happen on a regular basis as I have been charged by CDC to develop this coalition for global hepatitis elimination. And I really encourage all of the 35 countries represented here today to join that, develop a country page on that coalition, so you really become this part of this community of practice that's working toward elimination. And for me, the big energetic call to action that hopefully will make all of us want to run out of this room and get back to our desk and to our countries to work is this opportunity for exporting the Egyptian model of hepatitis C elimination to other countries in Africa, as we have been talking about earlier today, where you have a package of proven interventions. You now have a good quality treatments, experience in decreasing the cost of diagnostics, and through that, engaging policymakers. You know, one of the key reasons that we have disease elimination goals is to engage stakeholders in that call to action. And I think you've really seen that evident on the podium today and right now currently. So we really want to work together, begin to answer that call from an invitation from Egypt and that call to action and get these programs implemented. And then in that process, we're going to be changing those health systems so that when we come to that day, hopefully in the not too distant future, where we have these more effective functional cures for hepatitis B, we have a health system that has more clinicians trained to deliver those interventions to treat hepatitis B and better laboratory systems and the like. And so I believe I joined with Shireen from FARCO to really encourage everyone to work together, because I think by working together, we will achieve elimination. Thank you.
I would like to thank very much FARCO, really, and Gilead and Abbott, Sysmex and Cepheid and Mylan, who made this meeting happen, because without their sponsorship and really the leadership and trying really to unite, to bring in a lot of African countries to unite and eliminate hepatitis and indeed health for healthy liver disease. Thank you very much, and thanks, Dr. Shireen. Now it's my pleasure to introduce Professor Mahmoud Al-Mitaini. I think you saw him, you saw his lecture the first day. He's the president of Ain Shams University, and he gave huge support to this meeting. And also he's, as you know, the founder of liver transplantation in Egypt, Professor Al-Mitaini.
Thank you very much, Manal, and I would like to congratulate you and all the organizing committee for getting all of us together and making such a successful meeting over the past 3 days. I would like to thank also Viral Education for giving Ain Shams University and the Faculty of Medicine of Ain Shams University to collaborate together with them and with others, with all our colleagues, to make this meeting first happen, and then I think it's a success. I was really delighted when Manal told me a few months ago about the idea of the Congress, and it will be the second chapter or the second edition being held in Africa after what happened in Kenya. And we want to make it even better, and it's always, you know, things that usually used to be, should be better in the second edition and the third edition and so forth. So working with the CDC and getting John Ward and hearing from as the first speaker in this Congress, it was a great talk, John, and I really enjoyed it. Followed by others, colleagues, and getting our African colleagues from all over Africa, with colleagues from the States, Europe, civil societies, NGOs. I think it's a great idea. So I applaud you and I praise you all for making it. I would like to extend my real endorsement and support, personal and as institution, as Ain Shams University, with the permission of His Excellency, the Minister of Higher Education, for the third and fourth edition. Whether it be in Senegal or elsewhere, be sure that Ain Shams will be there, and with all the support from the Faculty of Medicine, and maybe with more participants and more speakers and more endorsement. I really enjoyed the first day, and excuse me if we were not able to attend as much, but I was following on all the details with Manal and the organizing committee. I should also thank the pharma industry, FARCO, Roche, whoever there, because without the pharma industry, meetings like this could never happen. So thanks are due to all the pharma industry because of their huge support to our meetings, to our congresses, whether in Egypt or elsewhere. Just before concluding, I couldn't conclude without congratulating all of our country and thanking our president and our higher authorities for supporting what John said, the Egyptian model or the Egyptian program, which really became a model worldwide and an exemplary for everybody, want to eliminate and eager to eliminate a given disease, especially in the field of viral hepatitis. So the presidential initiatives, the 100 million health and I think other initiatives are really great things that we're really all proud of, and we worked already hard in it and we'll continue to work even harder. But I cannot finish before saying that it has been a long journey, the HCV. I'm a humble surgeon, as you know, and I was speaking about hepatitis C virus in this country ever since the beginning of the 90s. As a national security problem. I was considering it a national security problem, and the only man who was supporting my ideas was Manal's father, Professor Hamdi Said, because he was by that time. And we were the only two in this country in the 90s and the beginning of 2000 speaking that HCV is a national security program, until Professor Hatem al-Gabali came as a Minister of Health in the late 2008, 7, 8, 9, when he started the Supreme Committee for Viral Hepatitis, which Manal is a member of, and I don't know if Ayman Yusri or Wahid Dos or these players, these were the real players who started the journey. So the journey started more than 10 years ago, say 12, 13 years ago, and then things and successes, success after success came. So thanks to the Supreme Committee of Viral Hepatitis, and thanks for the successive Minister of Health from 2010 to date. They all did a great job, but it's really, has been concluded and evoked by the presidential initiative by President Sisi in the last few years. Thank you all, and I hope that I'll see you in the third edition, wherever it will be in Africa, and we'll be with you always. Thank you very much.
Thank you very much. I think we would like to ask for your assistance if anybody needs assistance for management of hepatocellular carcinoma in Africa, or even to establish liver transplantation centers. And I think that was a request yesterday, and I hope that Ain Shams University can offer this in the future and we start to explore this possibility. Thank you very much. And now, His Excellency, the Minister of Higher Education, I would like to thank him so much for making the time to come here and support and endorse this meeting, and also to show the political commitment of Egypt and our president towards Africa, and not only management and treatment, but also scientific research in Africa. Thank you very much, Your Excellency, for being here.
Thank you very much, Dr. Manal, for inviting me to this closing ceremony of this important meeting about the Conference on Liver Disease in Africa, which I think this is an important topic that we have shared our experience with our sisters and brothers from our African continent. And this goes in line with the agenda, African Agenda 2063, talking about improving the well-being and the lives of our African personnel. One important challenge in Africa is health, and I think we all have to work in this respect in order to achieve better lives for our African citizens. I believe that during the last 3 days there was a very important discussions about diagnosis, prevention, treatment, and other issues related to liver diseases. With the help of virology education and the organizing committee to bring this gathering in reality with all our friends from the African nations, together with the expertise from different universities in Egypt, to bring them together in order to share our experience. I think that this is a marvelous job. And you add to this also the industry represented by the pharmaceutical companies and Farco and Abbott and other companies. That's another important challenge to bring all the sectors of this important disease together. I believe that by the end of this meeting, you should get on your way back home a very important message that the government of Egypt and politically and the policymakers are very much supporting our help, that this is an endless help to our African nations in order to bring all the facilities that we have in education, in scientific research, in industry, and make it available for our African continent. So before I end my speech, I think it's important to go out and to wish for everyone here a successful handouts for the conference and great empowerment of deliberations and important discussions for the benefit of our beloved continent. And I wish you all to have a safe trip back home. Thank you very much.